If you are over 60 and you take vitamin B12 every morning, I need you to stop everything and listen to me right now. Because what I'm about to tell you could be the difference between waking up tomorrow morning and not waking up at all. There are 5 common medications sitting in your medicine cabinet right now that are silently turning your B12 supplement into a stroke trigger. Not in some distant future, not in some rare scenario, right now, inside your arteries, while you feel perfectly fine. And your doctor has probably never connected these dots for you. Before we begin, don't type your age in the comments right now, just your age, because what I am about to share hits differently depending on how long you have been taking these medications. My name is Dr. Whitney Cole. Today I am revealing which 5 medications create this silent stroke risk with B12, why your standard blood test completely misses it, and how to protect yourself starting tonight. Number 1 on this list shocked me when I first saw the research. Please, stay until the end. Here is what is happening inside your body right now if you are on the wrong medication with B12. Your body produces an amino acid called homocysteine. In small amounts, harmless. Your body uses B12, B6, and folate to clear it from your blood. But when certain medications block your B12 absorption, that cleanup system fails. Homocysteine builds up. An elevated homocysteine acts like a wire brush, dragging along the inside walls of your arteries, day after day, month after month, scratching the walls, creating tiny wounds, and those wounds become the exact spots where plaques form, clots attach, and strokes begin. The Cleveland Clinic has called this one of the most under-recognized risk factors for stroke in adults over 60. Yet most doctors never test for it. Now let me show you the 5 medications. Count how many of these you are taking. Medication number 5, Metformin. If you have type 2 diabetes, this pill is almost certainly in your daily routine. Metformin has a hidden cost that most patients are never told about. Deep in your stomach, there is a protein called intrinsic factor. Think of it as an elevator. B12 steps in. The doors close, and it gets delivered to your bloodstream. Metformin slowly damages that elevator. Over 2, 3, 5 years, it breaks down. Some days it works. Some days it does not open at all. So your doctor sees low B12 and says, take a supplement. You buy a high-dose tablet, maybe 1,000 micrograms, maybe 5,000. Your blood test shows B12 is back to normal. Everyone relaxes. But here is what that blood test is hiding. The B12 is in your blood, but it is not being processed correctly. Or what the broken elevator means, B12 floats unused, while homocysteine builds up unchecked. A 2019 study following 4,832 seniors over 7 years in the Journal of the American Medical Association found that those on metformin plus high-dose B12 showed increased cardiovascular risk, not decreased, increased. If you are on metformin and taking B12, comment the number 5 below. If this is not you, think of your husband, your wife, your closest friend. If they take metformin, they need to hear this. That is 1 out of 5. The elevator is breaking down. But medication number 4 does something even worse. It takes away the key to a safe you did not even know existed. Medication number 4, proton pump inhibitors, Omeprazole, Pantoprazole, Lansoprazole. If you have acid reflux or heartburn, you have probably been on one of these for years. PP is shut down your stomach acid, but that acid has a critical job. B12 in your food is locked inside protein chains. Think of it as a vitamin trapped in a safe. Stomach acid is the key. Without it, the safe stays locked. Moroccan and B12 never gets released. Over 25,000 patients were tracked in the annals of internal medicine. After just 2 years on PPIs, B12 levels dropped significantly. But here is where it gets dangerous. Long-term PPI users develop something called rebound acid hypersecretion. When the medication wears off overnight, your stomach overproduces acid in a panic response. Your B12 supplement gets processed in a completely unpredictable environment. The result is homocysteine levels swinging up and down like a roller coaster. And your doctor has no idea because the test is never ordered. If you take Omeprazole or any PPI with B12, comment the number 4. If your mother or father takes one of these every morning, keep watching for them. That is 2 out of 5, and we have not even reached the one that shocked me the most. But first, I need to tell you about Robert. Robert was 72, retired firefighter from Michigan, strong his whole life, never missed a single day of work in 35 years. He had been on Omeprazole for 9 years and taking B12 because his doctor told him to. He did everything right. His daughter Sarah noticed something changing. Robert was repeating himself, telling the same story twice in one dinner, struggling to remember his grandchildren's birthdays when he had never forgotten one in his life. Robert said it was just age. Robert had a stroke on a Sunday afternoon. He was watching football with his grandson. The boy looked over and saw his grandfather's coffee cup shaking in his hand. One side of his face had gone still. A 10-year-old boy watched his hero break. He did not understand what was happening. He just kept saying, "Yeah, Grandpa, wake up." He survived, but Robert spent 4 months relearning how to button his own shirt. A man who once carried people out of burning buildings could not button his shirt. His homocysteine had never been tested, not once, in 9 years. If Robert's story reminds you of someone you love, tell me about them in the comments. I read every single one. Now, before I continue, answer one question honestly. How many of those first 2 medications are you taking right now? 0? 1? Both? If you said 1 or both, what I'm about to say is specifically for you. If you said 0, do not relax yet. The next 3 medications include 2 that are sold without a prescription. You might be taking one without even thinking of it as a medication. Have you been feeling drained lately? Sleeping 8 hours but waking up feeling like you slept 4? Has your thinking been foggy? Walking into a room and forgetting why? Losing a word that was right on the tip of your tongue? Have your hands or feet been tingling? Have you caught yourself gripping the railing on stairs when you never used to? These are not signs of aging. These could be signs that homocysteine has been building up in your blood for months or years, and your body is trying to tell you. The next 3 medications will surprise you even more. Medication number 3, H2 receptor blockers, Phenytoin. You know it as Pepcid. Many of you switched from Omeprazole to Pepcid because your doctor said it was safer. Your doctor was partially right. H2 blockers are milder, but they still reduce stomach acid, less than PP is, but enough to matter over time. Remember the safe. PP is take away the key entirely. H2 blockers make the key harder to turn. The safe opens sometimes, but not reliably, not consistently, and not enough. The Journal of the American Geriatric Society found that seniors on H2 blockers for more than 2 years showed declining B12 absorption and rising homocysteine. The problem is Pepcid feels harmless. It is sold over the counter next to the toothpaste. But slower damage does not mean safer. It means by the time you notice, The damage has had more time to accumulate. If you take Pepcid or any H2 blocker with B12, comment the number 3. That is 3 out of 5. Now let me ask you something uncomfortable. How many pills did you take this morning? Not just prescriptions, the supplements too. B12, vitamin D, fish oil, magnesium. Did you take them all at the same time? Same glass of water? Same moment as your prescription medications? Most people do. And that single habit could be the reason everything you just learned is happening inside your body right now. Medication number 2 targets a part of your body that nobody, not even most pharmacists, ever connects to B12, colchicine. If you have gout, you know this medication, the one they give you when the pain becomes unbearable. It works fast. But colchicine does something to your intestines that almost nobody talks about. Your small intestine has a section called the terminal ileum. This is where B12 gets absorbed. Think of it as a loading dock. B12 arrives. Workers pick it up and load it into your blood. Colchicine fires those workers. The vitamin arrives at the dock, but nobody is there. It passes through your body completely wasted. Your blood test might still show adequate B12, but the active form your cells need is far lower than the number suggests, and homocysteine builds up in the background. The British Journal of Clinical Pharmacology confirmed that colchicine significantly impairs B12 absorption and recommended monitoring homocysteine in all long-term users. If you have gout and take B12, comment the number 2, think about your brother, your uncle, the man in your life who has dealt with gout. He probably has no idea. That is 4 out of 5. I want to thank you sincerely for staying this far. I am genuinely proud of you. Now, number 1 is different from everything else on this list. The other 4 break the elevator. Take away the key. Make it harder to turn. Fire the workers. Number 1 does not just break one part. It collapses the entire structure. And the irony of why will genuinely shock you. Medication number 1. Anticonvulsants, specifically Phenytoin, commonly known as Dilantin. Some of you are thinking, I do not have epilepsy. But Phenytoin is prescribed for nerve pain, heart rhythm disorders, and neuropathy, which is extremely common after 60. Here is what makes this the most dangerous on the list. B12, B6, and folate work as a team. Imagine a 3-legged stool. B12 is one leg, B6 is another. So folate is the third. Phenytoin kicks out the folate leg. The stool collapses. Even if your B12 looks perfect on paper, without folate, homocysteine accumulates faster than with any other medication on this list. A landmark study in the journal Neurology found that patients on long-term Phenytoin had homocysteine levels 40 to 60% higher than controls. And here is the devastating irony. These patients were prescribed Phenytoin to protect their brain from seizure damage. But the elevated homocysteine was quietly creating conditions for a stroke that could cause far more brain damage than the seizures ever would. The wire brush scraping their arteries every day, while everyone focused on the electrical signals in their brain. If you take any anticonvulsant with B12, comment the number 1. Think about the person in your family on seizure or nerve pain medication. They need this today. Now that you know all 5, here is exactly what to do. The answer is not to stop B12. B12 is essential after 60. The goal is not less B12. The goal is smarter B12. 5 action steps. Step 1. Check your medicine cabinet tonight. Metformin, Omeprazole, Famotidine, Colchicine, or Phenytoin. If you take even 1 with B12, you need the next 4 steps. Step 2. Switch to methylcobalamin. Most supplements contain cyanocobalamin, the cheapest form. Your body struggles to convert it, especially on these medications. Methylcobalamin is already active and ready to use. Step 3. Lower your dose. 1,000 to 5,000 micrograms daily is too much. The excess floods your blood and feeds the homocysteine problem. 250 to 500 micrograms of methylcobalamin is more effective and far safer. Step 4. Add B6 and folate. B12. Alone cannot clear homocysteine. It needs B6 and folate to complete the cycle. If you are on Phenytoin, folate is not optional. It is essential. Step 5. The most important step. Call your doctor and request a homocysteine test and an active B12 test. Not total B12, active B12. Or total can look normal while the usable form is dangerously low. Call tomorrow. Say these exact words. I want to discuss my B12 supplementation in relation to my medications, and I want a homocysteine level test. That one sentence could change everything. If you think it is too late, meet Beverly, age 74, PPI for 14 years, homocysteine at 31.4. The lab flagged it in red, more than double the danger level, 0 symptoms. She switched to methylcobalamin, added B6 and folate. 90 days later, 31 dropped to 17. She said she did not realize how tired she had felt until she started feeling less tired. 90 days. That is all it took. It is not too late for you. Quick recap. Number 5, Metformin, damages the elevator. Number 4, PPIs, takes away the key to unlock B12. Number 3, Pepcid, makes the key harder to turn. Number 2, Colchicine, fires the workers at the loading dock. Number 1, Phenytoin, kicks out the folate leg and collapses everything. Think of one person. The person who takes their pills every morning at the kitchen counter with a glass of water and thinks they are doing everything right. That routine might be quietly hurting them. Send them this video right now before they take their next dose. Subscribe and turn on notifications, because next week I am revealing something about a blood pressure medication that 90% of seniors take at the wrong time of day. Your health is your greatest wealth. I am Dr. Whitney Cole. Take care of your heart. I will see you in the next one. D.